I could send my vagina to the closet and lock the door and put on some chains, and like I'd never have to worry about it again. I thought this was great. So I did that for 9 years. For 9 years, I didn't have a period. And then it came time to have a baby, and I ended up stopping my birth control pills. And it was this really wonderful experience for me to start to reintegrate with my body. I had totally fragmented that part of my body. In fact, I started calling my vagina yoni. Do any of you all know the word yoni? It's a Sanskrit word. I love this word. It's a kind of very sacred word referencing the female genitalia. But beyond that, it also is talking very much about kind of the divine feminine, sort of a spiritual awakening within. So I love this word, and that was the only way I could really deal with my vagina, was to elevate her to this kind of spiritual plane. So I'll introduce you all to yoni. You know, and I think so often there are messages that come to us. I see some nodding here in the front. There are messages that come to us, and I think this happens even more as you get older, that your vagina sometimes can have things to tell you. And I ask my patients a lot of the time, if your vagina had a voice, what would she say? I had one patient, she had been trying to get pregnant for 4 years, and she had gone through all the testing, everything had come out normal, and nobody could really figure out what was going on. So they sent her to see me, kind of the vagina whisperer. And I asked her that question, and she started to cry. And she went on to tell me that she had been molested when she was 8, and she had never told anybody. Her mother didn't know, her husband didn't know. And we had this whole conversation about whether this could be related. You know, is it possible that the fact that she'd been molested was related to her infertility? And I'm a big believer in not having secrets about this area. And that's a lot of what my book is about, is to really facilitate this dialogue. And I think it's really important to have that conversation, to tell our stories, to share our traumas, to celebrate the feminine. And to do this without shame or guilt or embarrassment, but really to do this from a place of great love and wisdom, and, like I said, a celebration of who we are as women and that part of our body that makes us uniquely female. And that's a lot of what I've been inspired to do with this book. And what I would like to do with us here at this gathering is just to be able to talk about these things, because, and not just in a way that's scary, not just talking about unwanted pregnancy and sexually transmitted diseases and rape. And we can talk about these things, certainly. You know, no subject is off limits. But I also want you to be able to just ask what you're curious about, and laugh and share and tell me anything you want to, ask me anything that you want to. So I'm going to start. Is this an issue? Do you guys are you curious about this? This was one of the This was one of the most common questions I got asked when I wrote this book. The 2 most common questions I got. Number 1 was, is it normal if my inner labia hangs down longer than my outer labia? And the answer is yes. Number 2, what's that face? Yeah, did you guys know that? Did everybody here know that? Yeah. We get this idea. Where's Yoni? Yeah, demo. Oh, you have Yoni. So, I don't want to get off track too much, but yoni. So, a little anatomy lesson. Clitoral hood, the head of the clitoris. Did you guys know the clitoris actually goes all the way down like that? That we have these legs of the clitoris? Yeah, you can't see them on yoni here. They're underneath here. But a lot of people think that the infamous G-spot, have you guys heard of the G-spot? Yeah, there's a lot of controversy around that, and there's a bunch of questions in the book about that. But a lot of people think, and there's new research to support it, that the G-spot, which is accessed through the vagina from here, is actually maybe stimulating these legs of the clitoris. So a vaginal orgasm and a clitoral orgasm, they may be no different. It's just stimulating different parts of the clitoris, and it may feel different and be stimulated differently. But anyway, this is the clitoral hood, the labia minora, the labia majora. So the question is, if you look at a lot of images in the media or in Playboy, it looks like this, right? But there are a lot of women that have, labia that hang out, these inner labia. And I got a ton of questions about this, like my inner labia are too long, is there something wrong with this, should I have them cut off? Seriously, and there's a whole section in there. There is plastic surgery out there, and these people make me crazy. There's a rant in the book about vaginal rejuvenation surgery.
When you have a baby, though, doesn't that actually change anyway? Like you're just...
Not usually. The vagina itself changes. The labia themselves don't usually change much in shape, unless there's a tear or something like that. So anyway, that was the most common question. And there is actually, believe it or not, research. Somebody went out and took several thousand women and measured their labia minora. So if you're curious where you measure up, and yes, I did have to pull out the measuring stick. If you're curious where you measure up, the graph is in the book. The second most common question I got was about odor, about vaginal odor. In fact, let me pull out one of the sections. Have you guys seen the vagina monologues? Anybody remember the section about how things smell down there? Oh, exactly. I don't want it to smell like rain. So I'm just going to read you a little section from the book here because I loved writing this part. See, everybody remembers that part because, again, I think we worry about this stuff. This is from the chapter that's called How Coochies Smell and Taste. When many women
I've done at colleges so far at Northwestern and Northeastern, interestingly enough, we're both on stages with big, podiums and signs and slide projectors and things like that. And what I've discovered is that you college students are kind of shy, which is funny because I know a lot of college students and they're not shy. But something about putting a doctor in front of you on a stage with a podium seems to kind of change the vibe a little bit. So I'm hoping this time we can actually do what I really love to do, which is just sit around and chat. We're just people here talking about what's up down there.
Coochies.
Coochies, absolutely. So this is really an opportunity for you guys to, to really get your questions answered and to sit around and talk and realize that we're not all that different and that we all have stories and that there's nothing to be ashamed of. And it's an opportunity for me to do what I most love doing, which is helping women and interacting one-on-one and just kind of telling our stories and connecting in this way. Because, it's tempting when you think about vaginas to put everything in the closet and just not talk about it. And any other comments about that?
It can also be a religious, cultural.
Yes, it obviously is also a religious, cultural thing, just like circumcising women. So like I said, the arguments for it both ways are yes.
I'm not necessarily for male circumcision either, but I think something that makes them really, really different is that with female circumcision, it can result in a fistula, which is really, and that just doesn't happen with male circumcision. And a fistula is a really gristly thing where your digestive system and your vagina become connected in a really awful way, and often the women who have fistulas are really kicked out of the town and made to live on the side outside on the outskirts of town as a leper, as a leper, and often they starve to death or get eaten by wild animals, and they're just left for dead. And I feel so not that we should do male circumcision, but I feel it's very different.
It's hard to compare the two. Do you guys, do most of you know about fistulas? No? Yes? So fistula basically means that there's a connection. I'm an artist, when I'm without paper and pencil, it's often hard for me to describe things, so I'll do the best I can. But fistula basically means that, okay, if this is let's say this is the vagina here, and this is not anatomically a good way to do this, but up here would be the bladder, and down here would be the rectum, and I'm going to say this is the vagina. So what can happen is the vagina, when you have a fistula, there can be a hole on the top. If there's a hole on the top of the vagina, then the bladder can leak out of the vagina. So if you don't have something holding in the urine like you do in the urethra, you have a urethral sphincter, and that's what relaxes when you go to pee. If you have a fistula, every time fluid comes into the bladder, it just comes out the vagina. So you're just leaking urine all the time, and there's nothing holding in the bladder. If you have the rectum on the back side here of the vagina, if there's a hole on the back side of the vagina between the rectum and the vagina, then poop is just coming out of your vagina. So you can imagine vaginal infections up the wazoo, pain, odor, smell, up and down the whatever. Down the
Different kind of smell.
Obviously, both are horrible. Both cause all kinds of health problems. And socially speaking, in this country, fistulas are usually caused by birth trauma, difficult labors and things like that, and they can be repaired surgically. It's a very difficult surgery. In places like Africa, where women are getting circumcised, this is happening often because they're having birth difficulties, because it's hard to get a baby out of a vulva that's sewn shut, and so the baby's basically laboring through the vagina and often putting holes. And like you said, there are whole colonies of women that have gathered together who have fistulas. So clearly comparing FGM and male circumcision is, it's a fine line to walk. But I put it out there just because my bigger overlying message is that I think the more we can learn to love our bodies the way they are and the less we can cut them to try to fit into some social norm, the better off we're going to be, whether that's, breast implants or nose jobs or male circumcision or female circumcision. Our bodies are beautiful, or vaginal rejuvenation surgery. Our bodies are beautiful, perfect, just the way they are. They don't need to be cut.
Who else? Anybody else? Yeah.
Well, like my mom, because she'd tell me nether regions in Chinese, just like she'd just sort of gesture.
Nether regions?
Like the nether regions, but she said it in Chinese.
Yeah, it's funny, these words that we get out there. And who else? What else did you? Yeah.
Well, when I was in 5th grade and we had sex ed, our first homework assignment was to give Pokemon names to all the parts of the female genitalia. So there were things like Bulbasaur, I think is the only one I remember.
That's awesome. I haven't heard that one before. That's a good one. Yeah.
We just, like me and my sister, we just used to call it like our private part.
Yep. And see that, look at that message, private. This is private. Don't go there. Put her in the closet. Yeah.